So, good morning to all of you. Today I am going to discuss about the emetic and the anti-emetic drugs. So, basically, emetic and anti-emetic drugs are given so as to decrease or to eliminate the sensation of vomiting, which we usually feel after watching something dirty or smelling something, or due to some other reasons also, like ear problem, or due to various other reasons. So it is basically caused by the chemotactic receptor zone. This is chemotactic trigger zone, and this zone is mainly responsible for the sensation of vomiting. It is an area on the medulla oblongata which is going to receive the impulse from the blood-borne drugs or hormones, and that is going to communicate with the other regions of medulla oblongata to induce vomiting. And this zone, which is present on the medulla oblongata, is outside the blood-brain barrier. This is the blood-brain barrier. It is present outside the blood-brain barrier, and so any drug would come and would act on the CTZ. That is why we have seen that the side effects of most of the drugs is nausea and vomiting. This is because it is present outside the blood-brain barrier. So now I'm going to discuss about the classification. Now there are two types I'm going to discuss over here. First is the emetic drugs, and other is the anti-emetic drugs. So now emetic drugs are basically used to cause emesis, to cause vomiting. In certain conditions we require to just vomit out the waste which is present in our stomach, so we need to clear that out. So for doing that we need emetic drugs. Now these emetic drugs will act on the CTZ because this is responsible mainly for causing vomiting. When the signals are sent to the brain, this will lead to vomiting. So this acts on the CTZ, and the drug is basically apomorphine. It is apomorphine which acts on the CTZ. Now the second medication, which is irritating gastric mucosa and CTZ, that is ipecacuanha. There is a medication in homeopathic also, that is ipecac, which is used when a person feels like vomiting. We give it basically. Now the anti-emetic drugs. Now the emetic drugs are only two, and it is rather easy to learn these, keep in mind basically. But the anti-emetic drugs, here we need a mnemonic which you need to follow, is the 5 A's. 5 A's are basically, I'm going to show you. These are anti-dopaminergic drugs. Then the second one is antihistaminics. Then the third one is anticholinergics. The fourth one is anti-serotonergics and adjuvant drugs, the 5 A's. Basically now we are going to and one more thing I want to tell, that during the chemotherapy which the cancer patients undergo, they basically induce vomiting. Why chemotherapy induce vomiting? This is because they act on the chemotactic receptor zone. Chemotactic receptor trigger zone, and so it leads to nauseatic and vomiting. So anti-dopaminergic drugs. Dopamine is basically responsible for inducing vomiting, basically the D2. So we are going to give anti-dopaminergic drugs which will they will stop the sensation of vomiting. They are selective D2 blockers and the non-selective D2 blockers. So here D2 selective D2 blockers, D2 dopaminergic. So metoclopramide, domperidone. So here D, D2, and here D, and even here D. So this is selective metoclopramide and domperidone. So here you are going to remember this, that selective D2 blockers, they have D in the end. Now non-selective are basically which have azenes. So chlorpromazine and prochlorperazine. Chlorpromazine and prochlorperazine, they are non-selective D2 anti-dopaminergic drugs. Azine and azine, they are non, and D, this you need to remember. Now next is antihistaminics. We have already learned the antihistaminic drugs which have zine in the end. Zine. So zine, यहाँ पे azine था, here there was azine, and here it is zine. So zine antihistaminics, promethazine, cyclizine, meclizine, cinnarizine. Yes. Now anticholinergics. Anticholinergics, here is hyoscine. This is muscarinic antagonist, muscarinic receptor antagonist. This is. Now serotonergics, basic serotonin. Serotonin is responsible for causing vomiting. So we are giving anti-serotonergics, that is sero and here sero. So ondan cetron and cisapride. Adjuvant drugs are cannabinoids, corticosteroids and benzodiazepines. So this is an effective way to remember the classification, and I hope all of you will be able to just learn it. I hope you like this video, and if you are new to the channel, then please subscribe my channel, share it, and thanks for watching. Do comment for more videos. Thank you.